Welcome back to MedBites. Let's go over the cardiogenic effect of adrenergic agonists. This is a high-yield concept that shows up in physiology, cardiovascular system, and pharmacology. Before we proceed, I'd like to inform you guys that this is going to be a two-part video for TikTok and Instagram, but the full video should be out on YouTube by the time you see this. Link in bio. Alright, let's proceed. The drugs that we're going to cover are dobutamine, dopamine, epinephrine, norepinephrine, isoproterenol, phenylephrine. So there's 6 drugs, and you gotta know which receptors they work on better and what order of receptors they work on. And it can get a bit confusing, but I'm gonna give you guys a couple quick rules that I personally use, which makes it a lot easier. So first things first, you gotta know the alpha receptors and the beta receptors. If you don't remember, I'll just give you guys a brief explanation of things that you should remember. The first thing is alpha 1 receptors cause vasoconstriction. You don't need to know the mechanism in this video, but you have to know the mechanism, which is, elevated levels of DAG, CAMP results in vasoconstriction, blah, blah, blah. You don't need to know that. All you want to know is right now, alpha 1 causes vasoconstriction, which results in elevation of blood pressure, and beta 1 results in elevation of heart rate. Okay, so dobutamine. The way I like to remember this is that dobutamine contains the letter B, which means that we're going to only be working with the beta receptors. So beta 1 and beta 2. And you know that beta receptor, these are all agonists. So beta receptor causes elevation in heart rate, and beta 2 receptor results in drop in BP. And that's it. That's dobutamine. Next, dopamine. Now, dopamine is the one exception to the rest of the drugs in the sense that it's the only drug that you have to know that also works on delta 1 receptors. And you have to know that dopamine is given in high doses and low doses. So if we show low dose and then we show high dose, how I like to remember this is by knowing that low dose and high dose means low accuracy of the order of the alphabets versus high accuracy of the order of alphabets. So what does that mean? If I say high dose, I mean high accuracy, which means we go alpha, beta, delta, and these are all 1. It's all going to be greater. And then low dose is going to be inaccurate, right? So delta, beta, alpha. And alpha results in vasoconstriction, which results in elevation of blood pressure. It's also going to, because the vasoconstriction happens more strongly than the heart rate, it's going to result in drop in heart rate. And that's all you gotta know. Now, dopamine receptors cause vasodilation. This is the only time you gotta know that. And vasodilation would result in drop in blood pressure, which would also result in reflex tachycardia. The next drug that we're going to cover, let's make a new page, is epinephrine. So epinephrine as well, just like dopamine, has high and low doses. But unlike dopamine, it does not have a D in it, so we're not going to be dealing with any delta receptors. Here, we're going to just deal with alpha and beta receptors. So as we said low dose means reverse alphabet, so it goes beta and then alpha, whereas high dose means alphabetical order, so alpha and then beta. One would result in increase in heart rate and a drop in blood pressure because it acts weakly on alpha 1. The reverse is true for high dose. So alpha 1 gets worked on the most, so it would result in an elevation in blood pressure, and this elevation in blood pressure is much stronger, which would result in a drop in heart rate. It's much stronger, so it works much stronger on alpha 1 than it does on beta 1, which is what you get here. Isoproterenol. So if you guys remember in your basic biology classes, we always talked about concentration of solutes inside and outside of a cell. Hypertonic, hypotonic, isotonic, and iso meant that they are equal outside and inside. So here isoproterenol is beta 1 equals beta 2, so it works on both equally, which would result in an elevation in heart rate and a drop in blood pressure. The next drug is norepinephrine. Now norepinephrine, just I like to remember it as it just works like a normal high dose epinephrine. So it follows the same pattern that you see over here. So it goes alpha 1 greater than beta 1 greater than beta 2, which would result in vasoconstriction, resulting in an elevation in blood pressure, which would result in a drop in heart rate. And the last drug is phenylephrine. Now, phenylephrine is the only drug that works on alpha 1 receptors, which would mean it would result in an elevation in blood pressure and a drop in heart rate.